guys, I'm going to show you how to do the upper quarter wide balance test. I'm using athletic tape for the directionals here on the floor. Plastic cups to use as measurements to measure my distance. And basically this test is used to evaluate injury prevention and risk assessments on people, mainly athletes. It's shown in some studies that I read over that athletes usually do better at the test than people that don't really form any or train any sports athletically wise, and also for people that have, let's say, shoulder impingements, usually like myself, like right shoulder impingement. I would have a little bit of trouble doing this with my right hand grounded, but usually those people that have a shoulder impingement do have some issues performing adequately in this test, as well as for people compared to people that don't have that general injury. Also, a couple other things. This test does have some measurements you gotta be clear about when you perform it. Is basically, some people use goalies. In a couple of articles I read, and also in class we talked about it, how to measure these angles. So basically, you're going to put the superior lateral, which is going this way, in comparison to the inferior lateral going behind. Let's say we're using the right arm as the grounded arm. So the superior lateral to the inferior lateral should be about 90 degrees using a goalie, and the medial stretch should be about 135 to each of the superior lateral and inferior lateral, 135 degrees. That'd be the right amount of degrees for the test. And what we're gonna do is, before you perform the test, you're gonna want an accurate measurement on everybody, all the participants, to keep kind of normative results for everybody. And what you would do is you would measure everybody's arm. You'd make them adduct the arm, and in a anatomical position, adduct the arm and measure it from the C7 to C7 spine, C7 process on your spine, which is the big bump on the back of your neck, all the way to the most distal digit, which would be the middle finger. And that's the measurement you'll carry on throughout the test to make sure you get a standardized result for everybody. And how we're going to do this is we're going to get in a push position like this, and we're going to use the owner side of your forearm. You're going to make sure that your first digit is on this marker, the athletic tape right here, is over the 3 joints of the angles, and make sure that your thumb is open like that. And then get into push-up position. Your feet have to be about a foot apart, kind of shoulder length apart. And we're going to start with the medial push. Try to not rock back and forth. Keep it steady. Push-up position as you do it. So push the foot as far as you can without bending your elbow. Then we're going to do this couple here, and then we're going to do this couple over here. And just like that is how you would test for any injuries or the athlete could have, or the person could have, or any risk factors that they could have. Let's say you would do that, and then you would measure with measuring tape from the middle point of where your first digit was to the front of the cup in centimeters, and you would do that to every measurement, and that's how you would get an average amount for everybody that does this test. Usually you would do 3 practice trial runs before you do the 3 trials per arm. So I would do this 3 times with my right arm grounded, and then I would switch and do it with my left arm grounded as well, just facing the other way, turning it around and going like this, basically stretching this way, this way, that way. And yeah, so basically, to conclude, this upper quarter wide balance test is to evaluate injury prevention and risk assessments, risk factors on athletes or anybody that does perform this test to make sure that you can perform it and you have good stability, flexibility for anything that could happen while you're